If you want to use the chat function, feel welcome to use that to introduce yourselves if that's something you'd like to do. Hey, welcome. If you're just joining us, we're just going to give it a minute or two just to make sure that everybody can get onto the call before we make a start. Feel free to use the chat function to introduce yourselves if that's what you'd like to do. Give it another half a minute just to see if anybody else wants to join, and then we'll make a start. Okay, well, it looks like the numbers have stabilised now, so I think we'll make a start. So welcome this afternoon. Thank you for joining me. So this is a webinar about completing your data security and protection toolkit for the 23-24 toolkit. My name's Sally Wilcox. I work for the Institute of Public Care of Oxford Brookes University, and I'm delivering this webinar part of the Better Security, Better Care programme. And I'm joined this afternoon with Rihanna, who's working there in the background on the technical side of things, and she'll be answering questions that you raise in the Q&A function. So by all means, if you haven't yet, feel free to introduce yourselves using the chat function. So this webinar is for care providers who are almost ready to publish their DSPT, but maybe have a few questions or things that are preventing you from actually going ahead and publishing. You're all on mute and you can't be seen, but if you have questions, please use the quick Q&A function that you'll see at the bottom of your screen, or if you're on a telephone, you can tap the screen to see the controls and choose more, and then Q&A will come up. Use the Q&A function rather than the chat if you can to raise your questions, because this is the channel that Rihanna's monitoring, and she'll be doing her best to answer those questions as we go through. So if you have any questions, straight away, go ahead and start posting those on the Q&A. Any questions we can't answer, we'll get back to you on. Hopefully we can answer them for you this afternoon. And this webinar will last no more than an hour, okay? And then we'll get you back off to whatever else you've got to be doing. At the end, we will send you the recording and this presentation with all of the links in it. I've tried to make the presentation as useful as possible with lots of links that will take you directly to the resources that you can see in the slides. Okay, so just before we start, it'd be really useful if we could just run a poll. So if Rihanna can launch that, just got 3 questions for you. If you could answer them, it's really helpful for me just to know who's on the call so that I can help to sort of target the material a little bit more. So the questions around the level your organisation's currently at with your DSPT, if you've personally used the DSPT before, and if you're a single or a multi-site organisation. So if you click on the questions there, and then once you've finished it, share your results, and then we'll all be able to see on the screen who's answered what on those. Got some standards met, some don't know. Somebody's done it before, a couple of people first time, and a 50-50 mix of single and multi-site organisations from those of you who've replied. No, a little bit more multi-site now, so maybe one more multi-site, more first time than repeats. And some of you not sure exactly what level you're at, and some are at standards met. Okay, great, thank you, that's really useful. Sharing the results there so you can have a quick look through those. Okay, right, let's get on then. So So on our agenda today then is about completing and reviewing your DSPT. So regardless of what stage you're at, whether you've done it before or you haven't done it before, whether your organisation's done it before or not, we're just going to run through some of the key points. We're going to look at any questions that might be holding you back with publishing. So do feel free to raise questions. That's why we're here this afternoon. We're going to look at what you need to do to publish or republish your DSPT. And then if we've got time after we've answered questions, we've got some extra tips, information about the support that is available to you, any other questions and next steps. So the DSPT is essentially a self-assessment which you need to complete annually. So ideally you update it when you have major changes, but you need to do it at least once a year. So if you completed a DSPT or your organisation completed a DSPT for last year, so that was 22-23, it is now out of date. As of the 30th of June, it is out of date. So you can't use that and rely on it as evidence for any of your arrangements, such as support contracts, CQC inspections, access to NHS shared information systems, for example, or transformation funding. So you do need to get on and republish. You can still complete the 23-24 DSPT at the moment because the system's been taken down for maintenance and we don't know exactly when it's going to be live again yet. So it still means it's on the existing template and system that's there for 23-24. So you have got a little bit of extra time, but I would suggest that you get on and do it as soon as possible. So in order for you to be able to get into your system, so it might be that your organisation has done the DSPT before, but you're a first-time user, or it could be that it's your organisation's first time, or it could be that you've done it for your organisation before, but you just need a refresher. So when you go in initially, you need to set up your organisation profile. So I've put some useful links in here about how to register, log in or change your registration. So I'm not going to go through that in detail at this webinar because this is about kind of the sticking points that you might have to publishing, but there is a lot of useful information. There are videos and things that will get you on so that you can get either registered or logged back in to your DSPT. And information about the local support organisations on that link there who can help you if you've got any difficulties with any of it. So the first thing you need to do is set up your organisation profile. And one of the key things that you need to do on there is to select here to show that you're a social care provider, as you can see on here. The reason for that is that the whole DSPT contains 78 questions and lots of different organisations fill it in. So it could be GP surgeries, it could be primary healthcare organisations, dentists, pharmacists. So we've done a lot of work with the social care sector to get the DSPT for social care providers to get it to the right set of questions in the right order for you. So by clicking that you're a social care provider, that means that you'll get the right questions in the right order to make it as easy as possible for you to go through and answer those questions. So if when you log in, you're not seeing at the top of your screen that you're in the social care assessment, you need to go back into your organisation profile, which will be on the blue band here, and click that button there to say that you're social care. If you're a multi-site organisation, you'll have an option then, once you go in to complete your assessment, to view the branches that you want to choose to include in your assessment. If you're able to answer all the same answers to all of the questions in the DSPT for all of your sites, you can do a single assessment. However, if you can't say that you've got all the same policies and procedures, all the staff training arrangements, and everything is all the same for data breaches and things in all of your sites, then you may need to do a number of different assessments. And some of the examples we get of that sometimes is that, for example, a care organisation, it's acquired a new site. So maybe most of the sites can all be done under one assessment, but you need a bit more time to bring the new site up to speed with all of your sort of arrangements for the rest of your business. So you might need to do one separately. But when you go into this screen here, you can view the branches and it enables you to tick which ones you're including in the assessment that you're doing. And then you could do a separate one for any ones that you need to do separately to that. If this is the first time your organisation has published its DSPT, then you essentially have two options. So you can either answer 26 out of the 42 mandatory questions and publish it approaching standards and submit an action plan to say how you're going to complete the remaining questions, or you can go straight ahead and answer all 42 questions to achieve standards met. So if you do the 26, you can only do that for the first year. And then when you next republish your DSPT, you would have to answer any outstanding questions out of the 42 that you haven't answered on the first time round. Or as I say, you can go ahead and do all 42 questions straight away, and that'll get you straight to standards met. If you're republishing, your previous answers that have been put in by your organisation, even if it wasn't you, if you go back into your organisation's DSPT, those answers will still be there. You can go in and review, and if you need to, you can update them. So if anything's changed, you might have changed, say, for example, your privacy policy, or something may have changed that you need to update. You'd have to answer all 42 mandatory questions. So if your organisation had published it approaching standards the year before, any unanswered questions of the 42 mandatory ones you would need to complete. So you might have up to 16 additional questions to answer if you didn't do those the first time round, as you can't republish at approaching standards. When you go back in after you've published for the first time, you only need to answer the 42 mandatory questions. So this can be a little bit confusing. So when you first go in to publish for the first time, on the social care assessment, you see all 42 questions and 26 of them are mandatory that you have to complete in year one. After your first publication, when you go back in, you go into a slightly different screen, which has got all 78 questions in it, and all 42 of the social care questions are then labelled mandatory, and it's those 42 that you need to answer. You can do the extra ones or any of the extra ones that you want to, but you don't need to. You only need to do the 42 mandatory questions. Okay, hope that makes sense. So what's new in 23-24? So one of the questions that social care providers fed back to us that they found quite difficult to answer was this question, 3.2.1, around have at least 95% of your staff, directors, trustees and volunteers in your organisation completed training on data security and protection and cybersecurity within the last 12 months. And it was quite difficult for organisations to say whether they met that standard that's set out by the National Data Guardian, because there wasn't a single kind of training resource that you could use and say, yep, that has actually met that standard. So last year we produced this toolkit here, which is a discussion tool and competency assessment, which is available on this link at the Digital Care Hub, which is a tool that brings together a number of different resources. And if you work through all of those resources with your staff teams, as you choose to, it's a flexible thing. You could do it one-to-one in team meetings as a training session, up to you. Then, and you complete the quiz with your teams at the end, then you could say that that meets that standard. But what's new in this year is that we now do have an e-learning training resource, which is available on this link on the Digital Care Hub. So it's specifically designed for frontline care staff in domiciliary care and in care home settings. And if they complete that and the assessments fully, and they pass the assessment up to the 80% required mark, then you can confidently say that your staff have you have met the standard for that question. And that training is free to access, and it's got a guide for managers on how to kind of handle and run that. And you can also download it onto your own learning management systems if that's something that you have as well. So that's something new that you might find very useful. So before I move on, I have identified some of the sort of areas that we know care providers find more tricky and can sort of be a bit of a barrier to them stopping from going ahead and publishing. But I just wonder, Rihanna, are there any specific kind of questions or themes that are coming through at the moment?
No questions just now.
Okay. Does anybody want to enter any questions at this time? We'll just give you a moment if there's anything specific. The areas that I've got to cover as we move forward, I've included business continuity planning, bring your own device policy, and register of processing activities and information asset register. So if there's anything else in particular that anybody would like to ask a question around at this point, go ahead and put it in. We have got some slots for questions as we go forward, so this isn't your only chance to ask questions. Okay. Right, so other questions that organisations have told us that they find quite tricky. So there are questions around whether your organisation has a business continuity plan which covers data and cyber security. So quite often we find that organisations have a business continuity plan, but sometimes it's missing or it's not very strong on those kind of cybersecurity and data protection aspects, and also about testing that plan out. So where to start really, if you haven't got that in your continuity plan or you want to kind of check how robust that is, we recommend that you start off by thinking about your critical IT systems and your critical kind of devices. And this can include paper files as well. So if you're carrying paper files which contains critical data like care plans or staff rotas, staff pay details, anything like that. So the idea is that you stop and think about what are those things that you need to use day to day in the normal operation of your business, of your care home or of your care service. So you would identify those as critical. And what are the devices that you need to use every day to access that information? So do you have a laptop or a smartphone, or do you have a desktop computer? Something like that, which is critical to your business, that if you didn't have that, if it got lost or broken or stolen, that would cause you real issues on your day-to-day kind of operation of your business. So there's some really good guidance on the Digital Care Hub here that I've put a link in for you, so you can access that and that'll give you some guidance. It also includes this template. So we've added a template. So each of those items that you've thought through, that is a kind of critical piece of data or a critical device, you can use a template to work through a kind of scenario basis. So this example here is that the laptop breaks down. Clearly, if you're a small organisation and you've only got one laptop, that could be quite a significant risk for you, whereas a large organisation, it's got lots of laptops, it can access the same data, then it's less of an issue. So you would go through to kind of prioritise what are your most critical things and start out there. So for this organisation, if a laptop breaks down, it's going to be a really critical thing. So what could happen? Can't access care data, loss of staff records, for example. And then usefully here, it's got a red, amber, green status. So you would rate how likely is that to happen? So is there a high likelihood that that laptop could break down? Maybe it's a really old device and you're thinking, oh, it's getting really glitchy. I'm really worried about it. Then you might put that as red. Or if it was a new device, you might say, well, actually, it's all singing, dancing, it's all new and it's performing really well. It might not be such an issue, might be green. And how bad could that impact be? So again, if that device did break down and you couldn't access the data, how significant an impact would that be? Would that be red, where it'd be really critical, you can't operate as a business without that data? Or green would be like, well, I just use another device to access it, or I've got paper backups, or I've got a digital backup somewhere, it's not such an issue. So how can you prepare just in case? So make sure backups are working and can be restored. Put in place alternative access to care data and staff records, or access cloud systems on a different device. So those are the some of the things that you could put in place. So it's always better to go for prevention over cure. So putting measures in place that prevent it from becoming a critical incident on your business continuity plan, always a good idea. And then you could say, who's the sort of person in charge of that? And when did you last test that? So important once you put all those things in place to make sure your staff are aware of the plan, so that if anything does go wrong, particularly when you're the duty manager or the care home care service manager is not around, they know what to do. And make sure you update your policies and procedures to match your plan. Test your draft plan to see the actions would really work in practice. So this is the second question around how and how often do you go around testing that plan? So there's some examples here. So you could mimic a power cut. You could hide a computer or a smartphone, lock the office door, say there's been a fire, we can't access any of our paper records, how are we going to handle this? Or send a pretend phishing email to staff and see if they open it. So just some sort of ideas there that enable you to test your plan. And again, you should be testing your plan robustly to check that it actually works and the plan works and that staff know what they need to do at least annually to meet that DSPT requirement. Okay, so quite a lot there. Hopefully that link will provide some useful kind of advice and resources there for you that you'll find useful. So moving on to bring your own device then. So this is another area which can be quite tricky and there's no one single solution for it. It depends on your organisation and how you go about doing things. But I have to say that I personally haven't come across any care providers who don't have anybody in the organisation who uses their own device in some way for their work. So it could be some things that you know about, that they access emails from their tablets or their smartphones. It can be some things that sometimes care providers overlook. So it could be that they're using a WhatsApp chat to talk about things, or it could be other things that you know about. They're using their devices to access kind of personal care records through a portal, that type of thing. So there's a whole variety and a whole spectrum of things that could be, staff could be using their own devices in terms of the work that they do for the care business that you're involved with. So it's easier to control if they're issued with work devices, but we know that that's not realistic for every organisation. And the benefit of people using their own devices is that they're very familiar with them and it doesn't take a lot of training or anything to get them up to speed on how to use them. If this is happening at all within your company, though, you do need to introduce a bring your own device policy. We've got a template for that on the Digital Care Hub that's sort of got some really good examples of the types of things that you need to think through. You need to enforce the policy, which you could do if you choose 2-3 staff contracts. Check that that's actually working. Then make regular checks that staff are aware of what they need to be doing to make sure that that data they're accessing is secure and safe. And think about how you do that in particular when staff leave. So if, for example, they've been downloading messages on WhatsApp, how do you remove their access from that chat group and how do you make sure they've deleted all of that chat or any other sort of evidence that they've got on their devices? Because they should no longer have access to any of that data. So there's some, I put some links in here for you. There's some really good guidance from the Information Commissioner's Office on bring your own device policies. And there's also some resources on the Digital Care Hub there. There's a good template for a policy there for you to think through. But just some of the kind of practical measures that you can think through are things like, do staff have like facial recognition, a PIN to enter their device? Even on WhatsApp, you can set up secure groups now. So if staff are using, say, smartphones at work and they're a device that is access to the family at home, can they lock specific apps down so that family can't access them? Are you advising staff not to use public Wi-Fi, for example, where their data could be seen by other external organisations? Are you able to track and wipe staff devices if they're lost or stolen and they might contain work data? And so some of those things. So for example, the organisation I work for, part of my contract I sign is that if I sign up to say I use two-factor authentication, that I've got a 6-digit PIN on my devices, and that if they're lost or stolen, I've given them permission to wipe them and set them back to manufacturer settings. So those are some of the sorts of things you can think through. There's some other useful resources. So some of the other things around protecting mobile devices and tablets. There's some more advice on Digital Care Hub. And the National Centre for Cybersecurity has got some advice about keeping smartphones and tablets safe, which you might find useful. And so on a more practical level here, there's some links here about how to find and erase Apple devices, Android devices, or Samsung smartphones as well. So some of those might be relevant for you to have a look at. Okay, moving on then. So questions about holding and sharing information. So the DSPT asked, does your organisation have an up-to-date list of ways in which it holds and shares different types of personal and sensitive information? So this is where we come on to talk about, you might have heard about a register of processing activity, or a ROPA, and an information asset register, an IAR. So if you don't have either of those in your organisation at the moment, this link here has got a really good step-by-step workbook that'll you just literally work your way through the workbook, and it will help you to get those things in place from like a standing start, from having nothing. They're a really good kind of starter's guide as to getting them into place. So it is a requirement of the Data Protection Act and GDPR that personal and sensitive data has a legal basis for being held and shared. And that means that care providers are legally obliged to keep a record of all the personal data they hold for staff, residents, families, carers, and what data they share with others. And to meet this requirement, the easiest way is to have two lists. So those that I've just mentioned, the Information Asset Register, the IAR, and the Record of Processing Activities, or a ROPA. So as a social care provider under data protection and GDPR, you're classed as the data controller. So it's really important that you have these things in place so that you show that you are in control of that data, how you're holding it, what you're doing with it, where you get it from, and who you share it with. So we've got a couple of really useful resources on the Digital Care Hub for you. These are all free for you to access. So there's a template here which will enable you to set up your information asset register. So it's got a list of 15 questions. So you need to think about the kind of categories of data that you hold at a fairly high level. So it doesn't have to be down to a granular level of detail. So say, for example, care records, medication records, staff records could be, that could work for you. You'll start to figure it out as you start to work it through. So it's got this template list of 15 questions. It's not difficult to do, but it just takes the time to sit down and work through the questions in the template so that you've got the answers to each of those questions for each category of data that you hold. Then for a record of processing activity, this is a list of confidential data, where it's received from and where it's sent to, and the legal basis for doing this. So all data in your IAR, the one we've just looked at with 15 questions on the template, if it's marked on there as being received from or shared with an external organisation, it needs to also be included on a register of processing activities. So your ROPA is like a subset of your information asset register. So we've got another template for this, again, free to use, available on this link. This time it's a set of 20 questions. So all those items on your information asset register that have come to you from somewhere or you share externally somewhere, you would then need to highlight those and answer these 20 questions for those data items. Okay, so again, not difficult, but just need to sit down and kind of work through it. There's guidance and advice on the Digital Care Hub and these really useful templates that you can use. And if you need any help with them, there's the workbook that I said on the first link there, but also your local support organisation will be able to help you with it if you need any help, if you've got questions or you get particularly stuck on any of it. And I'll tell you how you find those shortly. So further information and guidance, the Information Commissioner's Office has a template privacy notice. So two of the other questions within this set of questions for the DSPT was about your privacy notice and data protection impact assessments. So the ICO's office has got a good template for a privacy notice. We've also got one on the Digital Care Hub as well that you can look at that. You can use it for free. Even if you've got one, you might want to have a look at ours and see what it does differently. It sets out really clearly what you need to have in your privacy notice. So there's certain headings that you need. So the type of personal data you collect, how you get personal info and why you have it, how you store it, telling people what their data protection rights are and how they can complain if they're not happy with what you're doing with their data. And then data protection impact assessment is how your organisation minimises the risk to data protection when you introduce or change a new process, or you do a new project involving data protection. So it's mandatory question on the DSPT that you do that on your first submission. And that needs to be included in your data protection policy. So something really useful. It's like a risk assessment, but it's specific to data protection. There's more information there, which is from the Information Commissioner's Office. And even if you've recently done a project like this and you didn't do a DPIA, Data Protection Impact Assessment, it's recommended that you do one retrospectively, because there might still be data protection risks that you've not identified and gaps that you could close off there. So it could be, for example, something like you're introducing some new care planning software, or you're introducing EMR sheets for your medications, or a new payroll system for your staff. Those are some of the sort of examples that you might think about. So in order to, if you've not done the DSPT before for your organisation, or your organisation's not done it before, you're going to need an ODS code to be able to register, which will be mentioned on that more detailed link that I've given you about how to register. But just to highlight, your ODS code is your organisation data service code. It's a unique code to each organisation, and each of your sites will have an ODS code as well. You need that to be able to get access your DSPT. If you're having issues with finding your code, or you aren't sure which ones to use, particularly if you're like a multi-site organisation, or you need to group your organisations together differently, or you're having some technical issues with your ODS codes, you can contact our Exeter help desk here. So they've got a telephone number here, and they've got an email address that you can use there, and they're really good. They'll help you out with any technical issues around your coding. Okay, just because that's sometimes something that people just is stopping them from going ahead and getting back onto their DSPT. So that's, if you've got those contact details, that's quite easy to resolve for you. Okay, publishing or republishing your DSPT then. So what do you need to do now? So you need to get your login. So hopefully, if you've had that before, you can go ahead, log in, or you can find your details, or you can get back into your organisation's DSPT and get yourself added on, so that you can go ahead and do what you need to do for your organisation so they can resubmit. You need to complete all the mandatory questions in whichever view you're in. So if you're first time, you need to at least complete all 26, but you can do all 42. And if you're reviewing and republishing, remember you've gone into a window now where all 78 questions are in there. So you need to complete all the 42 mandatory questions. Review and update your existing answers. All of your existing answers will be in there. Just update anything that you need to change, if anything's changed within your organisation. And then you need to go ahead and publish. So it was by the 30th of June, but we've got a little bit of time now where you can still go ahead and do it as quickly as possible. So when you go into the DSPT, this is what you'll see, that you'll have the question number. The blue text is like a link that takes you to the detail of the question. It'll say here whether it's a mandatory question, and once you save your answer, it'll mark it as completed. Okay. So you can leave other questions that are not highlighted as mandatory. You can leave those blank, and click on the question that's in blue, and it'll do this. It'll take you into the more detailed information within that question. So for this one, for example, 4.1.1, it's a tick box question, which the majority of them are. So it's asked, does your organisation have up-to-date record of staff and volunteers if you have them and their roles? So hopefully you've got that in place. That could be on your payroll system. You say, yes, we've got that. And then there's a comments box, which says it's optional, but they're very useful. So we recommend that you use them and that you fill it in as if it's not going to be you that does it next time, to make it as useful as possible. So the tooltip here, so the extra text in the question gives you more information about what the question is asking for, or advice, and sometimes it contains links that will take you to further resources and further advice and information as well if you need it. So you tick the box, you fill in your comments and you press save, and then that will mark it as completed. So in our example here, we've ticked it, so it's yes. And our comments we put in staff and volunteers registered are contained in the HR files, both hard copies and electronic versions, which are saved on both the Google Drive and a portable G Drive in the Operation Director's office. The hard copies are kept in a locked drawer. So you might want to say which drawer. So that's just an example. Once you've completed all the questions that you need to do, you then scroll right the way down to the bottom of the page and click on this blue button which says Publish Assessment. Once you've clicked this button, it's important to remember that what happens is people can then go in and look at your organisation to see if you've published, and all they will see is that your organisation name and address, the date that you published, and the standard to which you published, so whether it was standards met or whether it was approaching standards. Nobody gets to see your full report, okay? So that is confidential to your organisation. It's a self-assessment. So the headquarters assessment, you would go into view branches, and in here you can click you can tick the branches that you want to include in that assessment. So as long as they have the same policies and procedures, IT systems and data security arrangements and staff training normally, then you should be able to say yes and do them all under the same assessments. If this happens after you've ticked publish and you get some items come up at the top of your screen in red, don't panic. It just means that these are mandatory questions that haven't been answered fully. And sometimes what's happened is you haven't saved the answer that you put in. So you might have gone in and ticked the box and typed in the comments, or you might have typed in if there's a comments for you to actually type in an answer or upload a document, and you may not have saved it. But usefully, what the red underlined links do is they are a link. So if you click on it, it'll take you to the question that you've not completed properly, and then you can go in, see what it is that you've not done. Maybe you missed it, you haven't answered it, or you've just not clicked save on it. So click save, answer it, click save, come out, and then it will be completed for you. Once you've successfully published your DSPT, you'll get an email which will look something like this to confirm that you have actually successfully published. And then if you want to, you can go in and check and see it on the DSPT site. You can search to see that you are published as well if you wish to do that. So I've mentioned throughout that there's free support and advice available to you. So they're on the Digital Care Hub, which is on this link here. There are lots and lots of resources, lots of advice, lots of templates that you can make use of. So it's free, it's official programme materials that go alongside the DSPT. There's a new online guidance that takes you through step by step. There's videos on how to answer every single question in the DSPT, webinars, FAQs, templates, our helpline, the extra helpline for technical issues. And there's also tailored support from 28 local support organisations around the country. For every question that requires some sort of document within the DSPT, we have a template for it. So you can either just use that to compare your own template and see if you've got the right kind of things in it, but still use your own, that's fine. Or you can use our template if you wish to. All of these are available on that link there, or you can click on them individually and that'll take you straight to that template that you're looking for. More advice on the Digital Care Hub there with links for you. And we have these 28 local support partners across the country. So they're available. If you click on this link here, contact your local support partner, click on that and it'll take you to a list so that you can find the right one for your area. But they can basically offer one-to-one support or small group support, help you answer questions, help you to publish, or connect you to your sort of local system if that's what you need. And if you're a large care provider, so sort of national multi-regional provider, there's a helpline and an email address there. And as I said before, for technical issues, there's the extra helpline telephone number there. Okay, that's been a lot. I'm aware I've thrown an awful lot of information at you. Hopefully some of that has been useful and has answered some of the questions that you might have been finding tricky to answer. But Rihanna, do we have any other questions that would be useful to highlight at this stage?
Oh, we literally just got one in. Let's have a look. Just as you asked that, what if you don't understand some of the questions, for example, regarding the annual IT penetration testing is scoped in negotiation between the board?
So if you're having any issues where you're really struggling with any of your questions, you can do a couple of things. So you can look up on the Digital Care Hub and do a search in there to see if there's any guidance and advice for you on the particular question that you're struggling with. And if that doesn't help, then you can look at that link that I shared just now to look up your local support organisation, and they'll be able to give you support and advice that's tailored to you, specific to what you need. And they'll be there waiting to help you. They'll be happy to help you. Okay.
Lovely, thanks, Sally. Oh, and also thanks from the person who's asked the question as well. No other questions just yet.
Okay, well, I've got a few more materials, so shall I proceed on to sort of look at a few more things? We've got a little bit, yeah, we've got a bit of time left. So, but if you've got any other questions, do go ahead and type them in and we'll come back to them, okay? So I've got some other, you'll get these slides anyway. We didn't manage to get through all of these last week because we had too many questions in. So some other useful tips for you. So if you're going back into your DSPT and you need to set up new users, you can go in under administration and you can manage users, and that enables you in that function to go in. So you need a minimum of one administrator, but we advise that every organisation has two, just because the administrators are the ones that can go in and add other people, edit permissions for other people. They can confirm the evidence, and they're the ones that can actually press publish on the DSPT. So it's always useful to have two, just in case one person's not around and you need to, do something on it. Or that person leaves, it's still got access to all your permissions on there. There are other levels of access that you can have though, so you don't have to give everybody administrator access. So some people you could give them member rights. So it means that if, for example, you had certain questions that you want to allocate to somebody else, say you had like, I don't know, a deputy manager or a senior carer or an IT person, who you thought, or an HR person, you thought, well, I could give them these particular questions to answer. If you set them up on there as a member, they can go in and they can edit evidence and add to it, but they can't do any of the other things the administrators can do. So they can't add or take off other users, they can't change permissions, and they can't publish, importantly. And the other kind of level of access that you can give is viewer only. So it doesn't get used very often, but say if you were working with, I don't know, like a senior director who just wanted to be able to see what was going on in it, but they don't need to do anything else, or if like your local support organisation was helping you quite a bit and you wanted them to be able to see what you were putting in on there, you could add them in. So it's just something useful in case you might want to use that. So once you've completed your assessment, you can export it. And then that means that you can share it with other people in your organisation. So you've got a couple of options. So once you've completed your assessment, you'll see on the page when you go back in, it'll have at the top this progress bar, and underneath it, it'll say you can view previous publications and you can download your assessment. So you would click on that blue link there, and that'll take you in and you can download it into an Excel workbook, or the other option is to download it into a PDF. And particularly if you're a larger organisation, it's really useful to be able to share this with like your registered managers or other people. You might find it useful if you wanted to include it in, so like some of your staff training and things like that, or just to have a kind of offline version of your DSPT. So that's where you would find the link to be able to do that. So yeah, you can save it as a PDF. Go into your previous publications to save it as a PDF. View details. So the other thing that's available now is that you can download a certificate. So on the right hand side of my screen there where it says view previous publications, this is what other organisations would, this is like the level of information that another organisation would see about you once you're published. So they'll see which year to what level you've published, the date that you published, and then they'll see who it is, who your organisation is. But for you, when you go into this, it enables you to download a certificate. So if you've published a standards met, you can then go in and download your certificate. So that's quite a nice thing. Then you can share that news with other parties that you think might be interested, maybe commissioners. You can put it up in the wall in your care sites, care homes, care offices, and things like that, just so people know that you have completed your data security protection toolkit. So a bit more there about how to download your certificate. So under view previous publications and then download your certificate on that blue link there. So it's useful for multi-sites in particular to tell your branches that you've published at DSPT. We do come across organisations who they've done it and their branches don't really know, and they get in touch with us separately to start trying to do it, and then we look them up and find that they're already registered. And obviously you need all of your staff to be aware of what you said they're going to do in your DSPT, so make sure it's included in the training and the policies and procedures, and that staff know what they need to be doing then, that it's actually happening in practice. You can add your DSPT status to your website or even to your privacy statement. You could consider adding a link directly to your DSPT status, include it in bids. It is, something that's valued in that way. Tell your commissioners, NHS partners, and tell your IT suppliers as well. So we recommend that you keep your DSPT up to date throughout the year, and it makes it easier to republish when you come back into it the following year. You won't have as much work to do on it. So if you know that you've updated something, a policy, procedure, your privacy notice, something like that, it's a good idea to go in and do it if you can. Ensure managers and staff understand what's expected of them because of your completion of DSPT, and enable managers to access the information. So consider having a printout of the documents related policies and procedures in a manual, and that's also useful for CQC. So it's good evidence for CQC to be able to show them in like a paper folder or an online folder that you've got everything that relates, all those documents that relate to your DSPT all in one place. So next steps then, check out the guidance on Digital Care Hub. As I said, contact your local support partner, is the link again here, and you can look at us on Twitter as well, if that's what you'd like to do. It's not called that anymore, is it? So I think we're about there. Are there any final questions before we run our closing poll? Any other questions?
No more just yet.
Okay, well done for sticking with us. Hopefully you found something useful in there. So we're going to run another poll at the end. If you would please just take a minute just to fill it in for us. It's really useful just to know whether we're giving you the information that you need. So Rihanna's going to share that with you now. So if you could just take a couple of seconds just to answer the questions there. We've got what impact has it had on your confidence to complete the DSPT? So talking about this webinar this afternoon. How likely is it you'll complete your DSPT? Obviously not by the 30th of June, but will you go ahead and do it now? How likely is it that you'll contact your local support organisation for help with your DSPT? Would you recommend this webinar to another colleague? And where did you hear about the DSPT webinar? I've got a few questions coming in, a few responses. Thank you. Really useful. Okay, so Digital Care Hub newsletter, the website, local authority, local support partners were where you heard about it from. increased confidence. All of the you that have answered have said it's increased your confidence, which is lovely to hear. So thank you for that feedback. And many of you are very likely to now go ahead and publish. And very likely to contact your local support organisation. So share those results with you so you can have a quick look. Thank you ever so much for your time this afternoon. I hope there's been something useful and valuable in there for you. And that brings us to a close. So I'm going to give you a little bit of your afternoon back, and I hope you can use it to go and get yourself a cup of tea or a cup of coffee. Thank you ever so much.